Ambulance, what's the emergency?
Quickly, we're at Southport.
Okay,
On
Southport.
The Gold Coast, where the lights burn bright and the sunshine never ends. While many Aussies call it home, every year, 12 million tourists come to play on this stretch of golden coastline.
He was surfing when he got bitten on both legs by a shark.
I don't think I'm going in the sea again.
But the good times can often turn ugly.
I want the pelvic binder on him, OK?
And when they do,
She's not breathing.
these are the people you want on your side.
Nothing that we can't fix, sweetheart, right?
I know.
I'm still very concerned about this man. There's nothing like Ebola.
Whether you're just visiting or you live here,
My baby's life is going to be cut shorter because of this.
They don't want to see me die.
She can't be replaced.
these are the real stories
I love you too, buddy.
of the cutting-edge medical teams
Do not move your head.
We need to go in and get that clot out straight away.
Good work, guys.
who pick you up,
Okay, let's get moving.
It's the best job I've done anyway, for nailing things.
patch you up,
Superpower! The fairy dust. It's very magical and it fixes all sorts of things.
and put you back in paradise. Tonight on Gold Coast Medical, brain surgery results in a miracle right before your eyes,
We've got this very narrow window of opportunity where we can go in, keep that side of the brain alive.
and the patient is wide awake.
Keep very still for us. Do not move at all.
A young girl struck down by a mystery illness.
It's coming from my brain. That's the scary part.
Tense moments during a water birth. When a newborn plays a game of hide and seek.
He's under there somewhere, lovely.
And Bruce needs to brush up on his carpentry skills.
Putting some wood together, dang, 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 and then, yeah, nail it in.
Thanks very much.
Have a great day. We'll see you guys later.
Doctors Hal Rice and Letitia de Villiers are two of the hospital's specialist neuroradiologists who work together as a team.
Letitia's fantastic, great to work with, cool under pressure, and, you couldn't have a better person to be working with.
It's really difficult to work with. No, I'm just kidding. He's great to work with. Hal's completely casual. He likes to come in his thongs, board shorts, T-shirt.
Obviously doesn't look as glamorous as Dr. de Villiers, but, it's comfort.
I love absolutely fabulous shoes. Oh, these are one of my favourites. They're actually really comfortable. And of course it's...
And she goes from wearing that
to
this. So this is the great leveller. She can turn up in Louis Vuitton shoes and she's still got to wear these all day when she's operating, so I love it.
The reason for Hal and Letitia's double act in the operating theatre is the complex demands of their specialty, neurointerventional radiology.
So a neurointerventionist is a specialist that works with blood vessels in the brain and blood vessels in the spine. You can actually navigate along the inside of these arteries using a road map. And from the inside of the arteries, you can treat various problems in the brain, like a brain aneurysm or a stroke.
This type of procedure and the equipment used is very much a development of the 21st century.
We use this really high technologically advanced equipment, which is quite bulky and it can be a little intimidating to patients. So what we like to do is make the room as comfortable as we can.
Some of the operating theatre's computer power is used for a task that isn't medical, but is therapeutic. Well, that is, if you like Metallica.
We like having music on in the background because it relaxes everybody. We put anything on that the patient likes to listen to.
When the patients are brought into the operating room, it certainly relaxes them because it is a major thing for a patient to undergo this form of surgery.
Completing the rock and roll mood is a light show brought in and created by the team's resident gadget geek, Michael.
Michael's our head radiographer. He has an absolute predilection for LED lights and lasers. And so we always have some kind of interesting laser on the ceiling.
just after 11 in the morning, and the team's first procedure is finished. And Michael's ready for the next music request.
Black Keys or Rolling Stones?
Yep, sure.
Thank you.
But I'd rather have to put the Black Keys on.
But Letitia is about to lose control of the playlist when she takes a call from the emergency
I'll
department.
call you back in a second, Amon. What's his name?
A young man has been rushed into emergency, suffering sudden, total paralysis down the entire left side of his body.
Cal?
Yep.
Tot retrieval in a 27-year-old.
Wow. Where is it?
They're in emergency.
CT scans sent through to Letitia by the emergency department show a massive blood clot deep in the man's brain.
There you go, you can see it.
So I might call Amon and tell them to bring it for him to
Straight
come
up.
straight up here, hey?
The longer the clot blocks blood flow, the more of the man's brain tissue will die.
Oh, Lynn, it's Letitia. Is Dr. Sabet still there?
He became completely weak on his left side of the body, left arm, left leg, about 2 hours ago. So he's got a large piece of clot within one of the major blood vessels to the right side of the brain. And really, we need to go in and get that clot out straight away.
As the team prepare to work on the man, news comes through of a complication that will result in even more risks for this young patient.
Not so good.
I'm glad I'm not pushing it out.
You couldn't handle it, honey.
Kyra and Jimmy are having a baby.
For the past 6-7 years, I've been working underground in mining, so it's always been a fly in, fly out. So I've missed all the classes. You're right.
To be more accurate, Kyra and Jimmy are having a baby right now.
All right, keep talking. It's not going to stop because you stopped talking.
I sort of figured that.
We've had comments about this one catching baby. I'm sorry, we've got midwives who know what they're doing. Just please, for the love of God, let them do their job so that the baby doesn't get dropped, because I did not come this far to have someone drop the baby, and I know how slippery they are.
After spending the last couple of hours labouring at home and a final cuddle for Kyra's young daughter Bella, it's time to make the mad dash to the hospital.
I met Bella when she was 3. Do you want to drive out? I see Bella as my own anyway and treat her like my own daughter.
All right, let's go have this baby. It's getting ridiculous. At least it's a nice view.
The only birthing that I've seen has been on the farm, so it's only livestock.
So come on in, this is your birth suite.
Yay. My gosh, this looks better than my house.
Thankfully, they'll have midwife Ellen McLean lending a helping hand wherever needed.
Unlike the rest of the hospital, essentially we have well women, we have well families. We don't always deal with people that are sick. And so the atmosphere is always, oh, you've come to have a baby with us, yay. So you got a little girl or a little boy at home?
Little girl.
Little girl. And this one is a
Something that hasn't got 4 legs.
surprise. Okay.
Just a surprise.
Jimmy doesn't know much when it comes to women having babies. But he does know Kyra doesn't want it to happen in a bath.
She was talking about on all 4s
Okay, yeah.
as a possibility, but
So are you catching a baby today?
no.
No. I have every faith in you as a midwife. He doesn't need to be in this.
Right, you are, for sure. You're at the top end, are you? Just take a deep breath in and out again.
I've had a few wriggles on the way here.
Nice. Yeah.
I'm hoping for a little boy. It'd be nice to have a boy and a girl.
Baby's moved down, that's nice. Hey. So you're not keen on an actual water birth, just being in there for water immersion is the main thing for pain relief.
Yeah.
Great, okay.
Give me a hand.
Kyra's contractions are getting stronger and closer together.
Same spot.
So Jimmy does his best to ease her through the pain.
Were you paying attention when Mum showed you the massage technique?
Not a great deal. If I can keep her as calm as possible and just do as I'm told, really. I'm just there for show, I think.
As things start to heat up, at least Jimmy looks the part.
Made sure he bought his board shorts.
Yeah, I can see that.
Yeah.
Very sexy.
That just seems incredibly uncomfortable, eh?
You right there?
As for his usefulness, only time will tell.
Yeah, I've got it all charted up now, yeah.
Dr. Scott Paget trained right here on the Gold Coast.
I don't have any medical family members. My mother's a teacher and my dad worked in business, and I almost stumbled into medicine. And I had a lot of pre-medical colleagues, and all of a sudden I started growing an affinity for what they were doing, and I just saw the passion that they had.
So he swapped bioengineering for medicine and couldn't be happier working across the busy emergency departments.
You've got absolutely no idea what's going to happen. You know, it can lead to quite an exciting day.
And waiting for him in minor injuries today is construction worker Bruce.
It's the best job I've done anyway, for nailing things.
At his bedside is his mate John, who also happens to be his health and safety officer.
Probably still go back to work today.
Yeah, it might be a broom from now on.
G'day, Bruce, is it?
Yeah, mate.
How you going? I'm Scott, one of the doctors.
How you going, Scott?
Nice to meet you. What's happened here today?
Putting some wood together, dang, and then, yeah, nailed it in. Had my finger too close. Well, yeah, dumb thing to do, I know. But yeah, and I nailed it.
All right, what we're going to do is we're going to get you in and have an x-ray, and then once we've had a look at all of that, then we'll see what we can do to get things sorted for you, get that out of there.
Yep.
Perfect. All right, be back to see you in a little bit.
All right, no worries.
An X-ray will show the team exactly what damage the nail has done.
I'm off.
A young man suffering a massive stroke has thrown doctors Hal and Letitia into emergency mode. And to complicate things even further, he has a pre-existing heart condition.
His heart muscle is very dilated and it doesn't contract properly, and that's probably where the clot that's gone to his brain has come from.
When he's wheeled into the operating theatre, he is close to death. And with his heart function operating at just 10%, the anaesthetist believes that if they administer a general anaesthetic, it could kill him.
So 10%?
Yeah. No. Look, we love just doing the stroke under GA to keep him still, but because of his cardiac condition, we have to do him awake. Yeah.
Any anesthetic agents?
Yeah. Yeah.
So Phil, you need to stay absolutely still for us.
So the young man will be wide awake during his procedure.
We're good to do it awake, but we just want to do it ASAP. Well, that changes the day. We've got this very narrow window of opportunity where we can go in, remove that clot, open up that blood vessel, restore blood supply to that side of the brain and keep that side of the brain alive.
We need your help for this, okay? And you're going to help us by keeping us absolutely still as you can, all right? I know it's tough. We're going to just move you up in the bed and we're going to start this procedure, okay?
Now, are you able to roll your hand over the other way? Beautiful. Just hold that there.
In minor injuries, construction worker Bruce has scored a direct hit through the bone of his index finger with a nail gun. Luckily, the nail missed the joint. But it has passed through the bone marrow where an infection could cost him his finger. Bruce's workmate John is also the workplace health and safety officer, so he makes sure he's got a photo of what not to do.
Oh, yeah? Yeah, no, that's pretty cool. Yeah, something that shouldn't be there.
The job of removing the nail falls to orthopaedic registrar Dr. Henry Cann. The only tools the team will need for this procedure are a decent pair of pliers and some painkiller.
Peaceport.
They're giving you one of them to shut you up, mate.
Yeah.
All right, Bruce, it's your time to shine.
As well as the happy gas, Bruce has been given a nerve-blocking injection.
Can I start giving a little bit of a move?
Good man. Nice, slow Bruce. You're doing really well.
With just a thin layer of bone on either side, one wrong move could snap Bruce's index finger like a twig.
That's it. Nice, slow Bruce.
Coming out?
Doing really well. Doing really well. Nice, long, slow Bruce.
The nail is well and truly stuck.
Doing well there, Bruce.
And with every attempt, a fracture becomes more likely.
Good man.
No-nonsense couple Kyra and Jimmy are deep in labour with their first baby together.
I've always been a bit like water birth icky. I don't really want stuff floating around me, essentially.
But just in case there is a floater, midwife Ellen is prepared.
It's a pooper scooper. So we scoop it.
See?
It's for floaties. Nearly there, darling. Nearly there. What I want you to be doing is feeling. Feel what's happening down there and what's going to happen, and then go with that. And I've got the outside covered. I knew I always wanted to be a nurse back when I was 17. I did apply to the Royal Brisbane Hospital and I was accepted, but unfortunately, because I had a strained relationship with my mother, she got the letter, but she didn't let me know that I'd been accepted into nursing, so I didn't know. I became a nurse in 2007, and then in 2010 I became a midwife. And that's a girl. Good, long, deep breaths. It's been the best experience of my life, and it was definitely where I needed to be. You don't have to ever have a working day in your life if you do something you love, isn't that what they say? Every contraction is a different one. Every one that you knock down will be the last one of its kind.
Ellen discreetly uses a mirror to see how far the labour has progressed. From what she can see, it won't be long now. Which means a water birth is the only option.
You're okay, sweet pea. You're okay.
And how about you lift this arm up for me now? Okay, so no movement in this left arm at all, hey?
27-year-old Phil has suffered a massive stroke and is totally paralysed down the left side of his body. But there's more threatening his survival than just the blood clot choking his brain.
The problem is that he has bad cardiac failure, so heart failure, which makes the procedure a lot more difficult for us because we can't do a general anaesthetic, and it's also very tricky for the anaesthetist, and there's a lot of risk associated with it. It's actually quite dangerous. Got to keep very still for us now, okay?
It's a message they have to keep repeating.
You're going to help us by keeping us absolutely still as you can, all right?
If Phil moves, even a tiny bit, while Hal and Letitia are working in his brain, permanent brain damage could leave him paralysed.
Got to keep really still there, Phil.
Throw lights off, thanks.
With their game faces on, Hal and Letitia feed a catheter line up from the femoral artery in Phil's groin all the way into his head.
So this is right ICA, guys.
Biplane on, guys. Biplane on. Biplane on. Plane running.
Phil, you can't move your head now, okay? You need to keep your head very still for me. Keep very still. Do not move. Well done. I know that's a really hot flush on the right side of your face there. That's the X-ray dye going in, okay?
A squirt of dye into Phil's brain paints a catastrophic picture.
Big right MCA thrombus, hey? Huge clot.
Massive.
No, not much blood supply to the right side of his brain at all. Wow, look at that.
Out of control.
It's pretty impressive.
The clot is not going to be easy to reach. That mass is the clot-blocking blood supply, which is why so many of the arteries are not visible.
So the branch that we're trying to get into has got a very tight angle curvature on it to get into it, so it's just a little tricky to get around that corner, which is what we're doing at the moment. We're just pushing a little bit there. I know your head's hurting.
Phil is having to endure the weirdest intrusive pain you can imagine and remain completely still.
Yeah, that's him. That's perfect.
That's it, right on the clock.
Yeah.
Nice and still now, Phil. Nice and still, okay?
Keep your head straight.
Hal is ready to pull the clot out. Any head movement from Phil as the stent is dragged from his brain could cause a trail of damage.
We're just getting to this clot in your brain. You need to keep very still for us. Do not move at all. This is really important. Don't move. Keep very still now.
But he just won't lie still, so Hal can make his move.
So we're going to pull now. This might give a little bit of dural irritation.
Every second that the clot is in place, Phil's brain is dying.
This is going to hurt.
In minor injuries, Dr. Can has a problem. He can't get a grip on the nail Bruce has shot through his index finger. Permanent damage to his finger could hurt Bruce's ability to earn a living as a construction worker.
Come on, Betty, win the race.
Slow. That's it. Just all the way out with your breathing. Good man. Nice slow. It's gone. Done.
Bruce.
Well done.
Check this out.
Yeah.
Did you feel it, mate?
Just have
Yeah, a
a few
little
more
bit.
puffs for me,
Give it
please.
to 100 for
Yeah.
us.
The nail is gone, but it could have left an infection inside the bone.
How do you feel about staying overnight for hospital for a bit of IV antibiotics anyway, given that it's gone through your bones?
I don't think I will.
Another X-ray clears him of a fracture.
Looks pretty good.
And Bruce can't wait to get back on the tools.
So I thought it'd be, go straight back to work, you know. You know, that's what I get. I should have just pulled it out of work and went back to work. See you later, Blake.
And the experience might make him a little more cautious with his aim.
Ambulance, what's the town or suburb of the emergency?
Nerang. There's been a car crash. And he's spun out of control and he's bleeding from his head.
Such is the extent of the young driver's injuries.
High blood pressure, any medical condition.
The ambulance officers call for backup, and critical care paramedic Andrew Busby, or Buzz,
6692,
rushes to the scene. A critical care paramedic is a one-man band.
As a single officer response here, obviously I do work alone. I wouldn't have it any other way, to be honest. I've been doing it that long now, I don't know how I'd go with somebody else. My role is to predominantly back up other crews. I can be moved fairly quickly from one job to the other. That's really good.
Buzz has been warned the crash is a bad one. Judging by the damage, the vehicle was going too quick for a suburban street. Buzz swings into action.
Let's get the collar on, buddy. Don't worry about that. Let's get the collar on.
When the car hit a large tree,
Where are you hurting, mate? Everywhere. Everywhere.
24-year-old Jordan's head smashed into the windscreen.
Keep your hands down, mate. Keep your hands down. Keep your hands down. We're not choking you, buddy. We're just trying to keep your head nice and still.
At this stage, Buzz and his colleagues have no idea what they are dealing with.
What's going on, buddy?
At best, a skull fracture. At worst, a broken neck or brain injury.
Oh, I'm sorry. Basically, we just want to get him out where we can have a bit of a look at him.
But right now, getting him out is impossible. The driver's door won't budge, and Jordan is trapped in the wreck of his car.
No, not much blood supply to the right side of his brain at all.
In this procedure, which has never been filmed, specialist radiologist Hal Rice is about to pull a giant blood clot out of a young man's brain using a grabbing tool on the end of a fine wire. But there's a problem.
Drop the resolution, just low res is fine for this bit.
27-year-old Phil won't lie still.
You're just getting to this clot in your brain. You need to keep very still for us. Do not move at all. This is really important. Here's back.
Phil's heart is too weak to survive a general anaesthetic.
Don't move. Keep very still now.
So we're going to pull now. This might give a little bit of dural irritation.
This is going to hurt. Okay.
Really well, buddy.
Do you need an aspirin?
Hal must choose the right moment to draw out the catheter, or he'll inflict crippling drag damage on Phil's brain. And it's out. The clot is a monster, the biggest stroke maker the team has ever seen. And its removal has an instant effect. This is how the blood vessels in the right side of Phil's brain looked with the clot in. And this is how they look now.
Oh,
Fully open.
Okay, so it's open.
Very soft clot.
It went really well. It went really, really well. It's one of the best things we can do. I just want to see this guy move both his legs and his arms now.
Moments later, A miracle. He's moving.
Starting to move his left foot. It's good.
Well done.
Good work, guys.
Less than half an hour ago, Phil was completely paralysed down his left side.
It's my wife and kids. I don't see them as much as I should, and I would love to, but I've got a major passion with the work that I do and commitment to that, and seeing people doing well, like Phil and the other patients which we help every day, keeps you going.
It's gone really well. We're very happy with the result. We managed to get all the clot out. The big question will be how much brain damage there is and how much will recover. We're hoping, looking at the images that we've done, that he will actually make a full recovery, but we'll probably only know for the next few days.
So for Phil, the next 48 hours are crucial. Nairi is a 26-year-old animal lover who works at Dreamworld.
I've always wanted to work with animals. I knew I didn't want to just sit at a desk. So, yeah, all the animal handling interactive parts are the best, obviously. Come on.
While she might look like the picture of health, there are sinister signs that illness may take away the lifestyle that she loves.
I remember the morning I realised I couldn't hear. I was like dizzy, and it was like a hearing loss thing in one ear. I know that my balance isn't quite as good as it used to be.
The latest in a series of mysterious ailments is numbness in her right arm and shoulder. Desperate for answers, she's sought the help of neurologist Armin Sabat at Gold Coast University Hospital.
All right. So has the numbness changed at all? Any improvement?
It's still there on my shoulder. This doesn't feel as bad.
Okay, good.
Tingling.
Dr. Sabat believes the numbness is caused by a malfunction in Nairi's central nervous system.
Bend your elbows like this.
That could be a crippling degenerative disease.
You can just lie there, that's all right.
Inflammation of the lining around the nerves can involve the brain or the spinal cord. We really don't know exactly why that happens. Certain populations that the condition is more common in, young women, for example, fall into that category.
To get to the bottom of her problems, the next step is an MRI scan of Nairi's brain.
We'll come and talk to you once we've had a chance to look at all the scans. Is that okay?
Yeah.
Okay, bye-bye.
It's a frightening prospect for Nairi and her boyfriend, Luke.
Nairi and I have been together for about 5 years now, and we've done a lot of crazy things, travelled around the world and done a lot of exciting stuff in that 5 years, but this is probably one of the biggest hurdles we've had to cross as a couple. I mean, we roll with the punches. I'm just the boyfriend, so as long as I keep her supported, she'll be fine. It's just how Nairi handles it, and she knows that she's got a family and loved ones around her.
I know that it's coming from my brain, so I think that's the scary part.
Distant motorcade and suddenly there's joy.
A water birth wasn't part of Kyra and Jimmy's birth plan, but here they are, a few contractions away from meeting their first child together.
No, you need to be slower than that. Slower than that.
In 3 minutes, but you're running in your head.
I don't think we're very far. Come on, you good thing. Remember, I got you.
We've got no idea what the baby's actually going to be in regards to a boy or a girl. Kyra loves the element of surprise there.
Deep breath in.
And there comes a head. Ready? Just gently, sweetheart. I want you to be real soft. That's it. Oh, goodness. Eyes, nose, mouth, chin. Yay. Look at that. 2 arms and out he comes. He's under there somewhere, lovely. Come round. Come round. Pull him round. There you go. There you go, sweet. There you go. Yeah, baby. Come on. That's a girl.
Oh my God.
52.
A water birth. There is something I never thought I was going to do.
Being there for the moment a baby's born. Oh my gosh. There aren't words. There are so not words. Every single one of them, your heart blows up and explodes, and that's the absolute truth.
And as for the sex of the baby, that's something that Jimmy can deliver.
He's a little doodle.
We got boys.
It's been a long time since I've actually had any interaction with newborns. Hard to know what to expect other than what friends have told me, and some try and sugarcoat it and others just, you're in for torture and that's it. Lack of sleep, the joy that it can bring to someone's life, that's the part I'm looking forward to.
That baby's too good. It is so fabulous to see a woman who's not afraid in labour. They're proud of themselves.
Now I'm good.
It's a humbling experience, I tell you. It's just phenomenal to see them work their magic.
You're going to cut the cord, Jimmy? You see where you're going?
Remember, it's like calamari.
It's crunch, crunch. You can hear it, can't you? Go again. Is that free? That sounds good.
All done.
Lovely.
Ellen, you deserve that cup of tea.
I do deserve the cup of tea, actually. Don't you love your job? True, just can't love a job any more than this.
That's the stuff we work with.
Oh.
It's beautiful.
Thanks, hun.
Always wanted to have a family. Up until the last few years, it hasn't really been a big priority. And now that it's actually come, it'll certainly be one of the highlights of my lifetime, that's for sure.
"26-year-old Nairi has been experiencing episodes of partial paralysis for the last few months. She's hoping an MRI scan on her brain will explain why her nervous system keeps randomly shutting down. Like any loving dad, Peter is sick with worry. And today, he's come along to discuss the results with the hospital's professor of neurology.
Sorry if I'm a bit nervous. But I am.
That's okay.
Come on in. I'm Simon Broadley. They've upped the ante. We're now with Professor Broadley, who's the senior person in this area.
So these are slices through your brain, and as you go up towards the top, you start to see these little white spots. And you've got these little white spots in several places.
The white spots are areas of inflamed brain tissue called lesions, and they're permanent damage.
This is evidence this has been around for a little while.
That one looks big.
That looks like a particularly active lesion.
The lesions have the potential to reduce Nairi's hearing, eyesight, mobility, and memory.
So you have this little lesion here, which is probably the cause of the recent symptoms you've had in your hand.
Oh, okay.
Yes, there's lots of them.
It's pretty clear to Professor Broadley just what's going on. It's frightening news, and it's not easy to deliver.
The fact that you've had what is now 4 episodes over sort of 2 years is slightly concerning. And also the number of lesions, and particularly how active the lesions are on the brain scan, is worrying. That all points to you having multiple sclerosis. So what are your feelings?
Scared, because it's such a big thing. No one in my family that we know of has ever had MS, so I never thought of it happening to me.
It's always a very tense and nervous time finding out any new diagnosis, but something like MS that most people have a vision in their mind of people in wheelchairs and being severely affected. It's a very worrying time.
It's been absolutely devastating, really. The MS has just come out of left field, and this second attack was particularly severe. So Nairi's been very ill, and we're all concerned that, you know, the disabilities are going to be permanent.
"27-year-old Phil arrived in the neurointerventional surgery suite, totally paralysed down his left side. A massive clot had shut down blood supply to half his brain.
Wow, look at that. It's pretty impressive.
With a heart condition making a general anaesthetic too dangerous, specialist radiologists, Hal and Letitia, had to remove the clot with Phil fully conscious.
Don't move, keep very still now.
Incredibly, Phil's brain started to come back online right away.
He's starting to move his left foot. It's good.
Oh, well done.
Good work, guys.
A week later, Phil's mobility is returning.
Ready to arm wrestle Wendell Saylor in a few weeks. The muscle.
And together with his parents, he's asked to say a big thank you to the pair who saved him from a lifetime of paralysis.
Hey, Phil.
How you going,
How
guys?
are you? I'm Hal.
Yeah, I believe I owe you a big thank you.
Oh, no problem. How are you, Ken?
Looked after you on
Karen?
Thursday.
Yeah, nice to meet you
Karen.
again.
Met you guys last Thursday. It was a little bit of a different story then. I don't think you remember much of it.
No.
And how you been feeling? You been sleeping okay?
Yeah, sleeping awesome.
Good.
Oh, good. It is absolutely wonderful to make such a difference in somebody's life. And it's the difference between somebody being either in a wheelchair or completely paralysed down one side to somebody who can function completely normally in society.
And I should say it is a team effort. Like, we're just two members of the team, and we've got a great team here at the hospital. It's certainly nice to see Phil doing well. And thankfully, you know, in a lot of these cases, when we get the patient in time, we're able to make a big difference to their lives.
And a fortnight later, Phil's back on his feet and taking his very first steps on the road to rehabilitation. "26-year-old Dreamworld animal handler Nairi is still reeling from the news that she has multiple sclerosis.
Such a big thing.
And it's hit boyfriend Luke hard.
Very large level of shock. How could it happen at such a young age? But I think, you know, there's not much you can do about it once you're diagnosed. That's it. It's a matter of just dealing with it. So.
Keep going.
Yeah, she's truly amazing. Very courageous, inspiring. Yeah.
Thank you.
MS is a condition that will need to be managed for the rest of her life.
With someone like you, I think we should be looking at something that's on the more effective side.
Just weeks ago, a new treatment returning good results in Europe and America was approved for use in Australia.
And this new drug, alemtuzumab, it's not quite a one-hit drug, but it's pretty close to it. It doesn't quite cure the disease, but it certainly makes it very low in terms of activity in the majority of people.
Unfortunately, alemtuzumab comes with a long list of side effects. It could destroy Nairi's thyroid gland, immune system, her kidneys, and also increase her risk of cancer.
Alemtuzumab does scare me a little bit. If I do get some side effect, then I'll be living with that the rest of my life.
Nairi has no time to waste. She must decide which treatment she will take before another outbreak of lesions does further damage to her brain.
We're not choking you, buddy. We're just trying to keep your head nice and still.
Critical care paramedic Buzz is managing the care of a young driver who hit a tree at speed.
High blood pressure, any medical condition.
24-year-old Jordan's skull struck the windscreen on impact. Exactly what injuries he's got is impossible to tell. Buzz won't get a proper look until the fireys get the mangled door off.
should be pretty right, mate, to just get him straight out of there, I think. So we're going to have to lift that up. You're right, buddy.
I'm really sorry.
That's all right, mate. You're going to have to lift the steering column up for me. Got his head. We're going to just shuffle his head, just bring his bottom round, guys.
Ready, buddy? Please, come with us. Please.
Right, he's good. Bring him up.
Please don't.
That's a shot.
Sorry, everyone.
Okay, Rob, in. I want his pants off and I want the pelvic binder on him, okay?
Rather than hand over to the ambulance crew, Buzz will stay with Jordan all the way to the hospital.
Mate, you're in the back of an ambulance. Hey, mate, just a heads up, coming in with a 25-year-old gentleman who's a driver of single vehicle RTC, high impact. Very lucky boy.
Very lucky.
At the hospital, it takes 17 staples to hold the top of Jordan's head together. He ends up being cleared of a skull fracture, but he isn't cleared of a drink driving charge.
This is a typical Saturday night. Nothing spectacular, nothing sort of out of the ordinary. It's, it's a typical Saturday night on the Gold Coast. Welcome.
We're just going to take you down to a nice little area down the bottom here.
Yeah.
To get you started.
Newly diagnosed MS patient, 26-year-old Nairi, has made a tough decision about her medication.
Are you right to sit?
Yeah.
For the day?
She's decided on a brand new drug called alemtuzumab that will slow the degeneration of her nervous system.
It's day one of a 5-day treatment. I'm more worried about the long-term side effects.
But after months of illness and uncertainty, Nairi is focused on the positives.
In a week's time, you start to feel really good. So I'm looking forward to that.
As soon as her treatment is over, Nairi is back doing what she loves.
This is Maddie. She's the one that needs a lot of training and haven't really been able to do it. She's can be quite a handful. I didn't really have the confidence when I was feeling sick.
We've already seen a lot of the signs that we could see before have gone. So it's good to see her getting back out there in the paddock and going for a ride. It is quite therapeutic for Nairi.
I have heaps more energy now.
She was doing a lot of weekend horse events and she hasn't done many for a while. The goal is to get Nairi back doing shows, that'd be great.
While this is a major step in the right direction, Nairi will need ongoing treatment every 5 years to keep all MS symptoms and lesions at bay.
Before I was just like, no, I don't want to do anything. But now I just feel good. So that's heaps better.
Next week on Gold Coast Medical, an extreme alert when a sick man arrives from Africa.
We have sent a sample of blood to the reference laboratory for testing for Ebola.
When this doctor isn't dropping in,
Are you seeing stuff? Are you hallucinating?
she's ducking for cover.
All right, okay. All right.
Rare twins in a life-threatening situation.
If the cord becomes entangled, it could potentially compromise their only lifeline.
And this young patient's injury is not nearly as painful as the call to his mum.
I have some bad news for you. It's kind of serious.